Infantile spasms are a type of epileptic seizures that occur in infants under 1 year of age. They can occur later than this, but that would be more unusual. They're more likely they occur between 3 and 7 months. Again, they can occur for very rare reasons in the neonatal period. The type of seizure is unusual. It's very short, and it consists of flexion of the body and throwing the arms out. And that would be the classical spasm. They tend to occur in clusters, but when they first start, they can occur singly. After the end of the cluster, the infant may cry. They occur very frequently from waking up from sleep. Sometimes the spasms can be very subtle and can just take the form of a head nod or a shrugging of the shoulder, or even sometimes just the rolling of the eye. In addition to the spasm, which is the epileptic seizure, it can often be associated with a developmental plateau or regression, or a child just becoming a little bit more irritable. And that will often prompt the family to seek a diagnosis. This can be quite subtle, especially at the beginning. It may be just a shoulder shrug or a rolling of the eyes, but when they these events occur in clusters, I think that should raise awareness. There may be the more typical spasms where you get flexion of the whole body and extension of the arms and legs. And when they occur in clusters, especially after waking from sleep, and it's often the crying of the infant at the end of the cluster that will alert the parents to the spasm. Well, one of the commonest things that we would see is that the baby may stop smiling, or the baby may not look consistently or look at faces at all. And usually that babies are very drawn to faces and they love interacting with their parents, siblings, grandparents. The infant may lose skills where previously they may have been able to sit with minimal support, was reaching out to play with objects such as on the baby gym, and they may stop doing that. But the first sign is often the lack of smiling and the lack of visual attentiveness. They're quite rare. They occur in 1 in 2,500 to 3,000 infants per year. So in Ireland, we should expect to see between 30 and 33 infants with spasms every year. The most common age is about 5 months, but they can present earlier or they can present later. Often the age of presentation is often related to the cause of the spasms. With children with structural brain malformations tend to present earlier, and those with no identifiable causes usually present around 5 to 6 months. There's a variety of causes ranging from congenital brain malformations, acquired brain injuries such as a problem during birth, or if a baby had a stroke during delivery. They may be due to a genetic reason or a metabolic reason, that's the way that we use energy, or a very rare unresponsive to vitamins, vitamin B6 pyridoxine deficiency. And sometimes we don't find any cause, but that's becoming rarer as our ability to do further investigations improves. As I've said previously, that with the onset of spasms, there may be a plateauing or regression of development, and that we know that early treatment and a good response to treatment improves the outlook in regards to development. And this is the reason why it's important to recognize and to treat early. And because they're a rare type of epilepsy, families may not know of this condition. Sometimes they can be misdiagnosed as colic or startle. But I think one thing that has really helped the diagnosis is cameras on phones, because people can take videos and those videos can be transmitted very easily. And we're often asked to look at videos by GPs. And that's become more common since the pandemic, as people are used to sort of virtual consults. And I may see lots of videos in the week, and I would have a low threshold for seeing any baby that had any funny movements. And it's always good to be able to see a baby and they don't have infantile spasms. It's just a normal aspect of development. So I would have a very low threshold for seeing any baby that developed any movement disorder. It's good to say it's not infantile spasms. So parents should never worry about bothering anybody. If they find that people aren't listening to them, aren't recognizing them, well, I think they've got to persevere, and they can send videos in to both of the neurological units in the hospitals in Dublin and Cork, because we're used to looking at videos. There's lots of examples on TikTok. One parent rang me about 2 weeks ago because they had seen something on TikTok that looked like infantile spasms, and they thought their baby was doing the same thing, and the mother was completely right. It was indeed infantile spasms. So I know that people do consult things like YouTube and TikTok, and I think that is good as well. There's lots of examples on the internet. The spasms will be diagnosed initially when the parents notice these movements and notice that they're different, or it may be another relative in a family that may notice that the infant's doing these strange behaviors. And that may prompt them to seek diagnosis, seek medical help. A very good way to diagnose the spasms is to take a video. It's always good to take a video of any unusual movements or paroxysmal events. And then when I see a baby in clinic with suspected spasms, that I will take a history. The parents may have a video with them, and then I will organise for an urgent EEG. That's where we look at the brainwave patterns, because infantile spasms are accompanied by an abnormal EEG called hypsarrhythmia, which is a Greek word for a chaotic pattern. And usually during the recording, we will get the infant to go to sleep and wake, and we will usually capture spasms on that recording, and then that gives us the diagnosis. Then we will start treatment immediately. We may arrange for the baby to be admitted, or sometimes you can manage it as an outpatient, but that's a bit more difficult because we have to organise investigations. So we will start treatment immediately, and the treatment plan is being designed from the results of international clinical trials, and we use vigabatrin and steroids, and we ask the parents to monitor the amount of seizures or spasms their infant is having. And then we will also look for an improvement and a normalization of the EEG. Once that we have diagnosed the spasms, then we look for a cause. And initially we look for the cause during the examination. We look for any changes in the child's skin, looking for conditions such as tuberous sclerosis or neurofibromatosis. These are conditions where the skin is involved as well. And we'll do a physical examination of the infant, and that sometimes can give us other clues. There may be something in the birth history or something in the child's development. We will always ask if the child has been developing normally. Then the next investigation was we want to get a picture of the baby's brain. and we do that through MRI, and that gives us very detailed information on the brain, and we can look for either an acquired abnormality that may have happened during birth, or whether the baby had a stroke, or whether the brain wasn't formed right during pregnancy. If the MRI is normal, then we would go on to do other tests, and we would do genetic testing, initially looking both at the number of chromosomes, that all the chromosomes were there and there was no pieces missing. And then we would go on and do single gene tests. We know that there are genes that can be associated with spasms, and we will also do metabolic testing. And usually that will give us the answer in up to 70% of cases. There are infants that we don't find a cause, and those are called idiopathic spasms. But we may investigate those infants or children at a later date, as in particularly genetic investigations improve all the time. In addition to the spasms and the abnormal EEG, there's often a change in the child's development, in the infant's development. They may progress or regress. So we will also involve the therapists, such as occupational therapists, physiotherapists, and refer to early intervention. So that can go alongside any medical treatment. And then we will monitor the response. If the infant doesn't respond to the first line treatment, we do have other options. We do have other drugs. And we also have the ketogenic diet, which is a specialized diet, which is very high in fat and very low in carbohydrates. And that is a diet that is very closely supervised with a dietitian. One of the other reasons for acquiring a brain MRI is there are some rare cases where the spasms, if they don't respond to medications, may be candidate for epilepsy surgery. That may be in cases of a condition called tuberous sclerosis, where there may be just one localized abnormality, or if a baby's had a stroke during the neonatal period, sometimes that they can be amenable to surgery. But that's a very rare phenomenon, and I don't want people to think too much about that. The prognosis will depend to a certain extent on the cause of the spasms. But usually we will manage to get control of the spasms in 70% of the infants. However, in the children that have a structural brain abnormality, that may be more difficult. Those are children who may have congenital malformations or may have been injured during birth. There are some infants that we don't get control of the spasms, and they go on and develop other seizure types, usually when they're over a year of age, and that's very distressing, and those will need to be treated in their own right. We're always worried about the development of the infant as a result of the spasms, because the epilepsy is like an acquired brain injury. So the development will be closely monitored, but there is an increased incidence of developmental disorders such as autism and learning difficulties. But in children who respond well to the drugs and respond quickly, usually their outcome is good. I think in the first instance, I would contact either your public health nurse or your GP, and I would take a video. Well, this is a very upsetting situation for parents, but I think the best thing to do is to capture the episode on video and then present to their local A&E department, where the video will be looked at, and then appropriate help and investigations can be started. There may be times when the episodes aren't infantile spasms, but that doesn't matter. It's very easy to reassure somebody and a family that their baby doesn't have epilepsy. In the first 2 years of life, the baby's brain is growing and developing rapidly, and the infantile spasms may interfere with this development. In addition to the spasms, it's often recorded that the baby's development plateaus or regresses, and early treatment of the spasms can reverse this process and help the baby to grow and develop normally.